Did you know that esophageal cancer is the sixth most common cause of cancer-related death globally? Hi, this is Dr. Nikhil Agarwal. I am Director of Gastrointestinal Oncology at Max Super Speciality Hospital, Saket. Once someone has been diagnosed with esophageal cancer, next step is staging. In staging, we want to understand how much the disease has grown because that helps us define the treatment as well as expected outcome. For staging, we do a CT scan or a PET CT scan. In some early cases, we also do endoscopic ultrasound. The idea is to understand how much the disease has grown locally and how much it has grown into the other parts of the body. It will tell us whether the tumor has grown into wall of the esophagus, has it gone outside the wall of the esophagus, and whether the lymph nodes which are around the organ are involved. This will also tell us whether the disease has gone into other parts of the body such as liver or the lung. Staging guides us to formulate a treatment plan. The treatment of esophageal cancer depends on the stage of esophageal cancer. For very early cancers, we operate them upfront, and based on the biopsy report which comes after surgery, we formulate further treatment plan. The tumors which are slightly advanced, we give them neoadjuvant treatment. It means that we deliver radiation and chemotherapy before surgery, and then we operate them, followed by further treatment if required. While some of the cancers, when we detect them, they are too advanced, they have spread to other parts of the body. These patients are treated with chemotherapy and targeted treatment and sometimes immunotherapy. Surgery for esophageal cancer, if possible, is the only curative option. In this, we remove the affected esophagus along with the draining lymph nodes. After removal of the esophagus, we have to restore the continuity of the gastrointestinal system. This is done by making a tube of the stomach and joining it to the remaining esophagus. This joint can be made in the thorax or in the neck. Earlier, we used to do this surgery with open technique. In open technique, we used to open the chest, we used to open the abdomen, we used to remove the esophagus along with the lymph nodes, and we used to make a tube of the stomach and then join them. This obviously resulted in cure, but because of the incisions, the post-operative period used to be painful, the recovery used to take longer, and patient used to stay in the hospital for quite some time. With advancements in technology, now we can do the same procedures with thoracoscopic and laparoscopic approaches, which are called as minimally invasive approaches. In this, instead of long incisions, we make holes in our abdomen and in our chest, and through these holes we pass camera and thin slender instruments, and we do the same surgery with the same precision laparoscopically and thoracoscopically. This has resulted in faster recovery, patients going home earlier, they resuming their diet and work earlier, and overall satisfaction scores are better. Now, with further advancements in technology, we have something which we call as robotic platform, which further aids the same surgical process. We have better vision, we have better control and better outcomes. Some esophageal cancer patients are either not fit for surgery or their tumors are not amenable to surgery, such as patients whose cancer is in the upper esophagus. These patients are treated with definitive chemoradiation. In this, we give radiation in slightly higher doses, and we also give chemotherapy at the same time. This will result in cure in some proportion of these patients. Unfortunately, not all patients come to us at a stage where we can attempt curative treatment. Some of these patients, when they come to us, their tumor has already spread to other parts of their body, such as lung, liver, and distant lymph nodes. In these patients, our goal is to improve their quality of life and prolong their survival as much as possible. For these patients, we do chemotherapy, targeted therapy, and immunotherapy. For chemotherapy, we deliver them with drugs which kills these cancer cells and decrease the size of these tumors and prolong their survival. This also improves their quality of life. Esophageal cancer, if detected early and treated appropriately, can result in cure. For this, we have to be mindful of the symptoms, and if we have any of these symptoms, we should consult our doctor and get investigated. Friends, I hope you found this video helpful, and if you have any questions or comments, please write in the comment box below.